Hello, my name is Penny Edwards and I'm from the South West Public Health England Health Protection Team. This is the third of 4 videos aimed at staff working in the care home, supported living and home care sectors. They cover a range of topics relating to the prevention and control of the new coronavirus known as COVID-19. This one focuses on admissions and isolation practices. The information in this presentation is correct as of the 8th of April, and so it's vital that you keep up to date with the most recent guidance online because we are learning new things about this new virus all the time. You can find most of the documents on the gov.uk website, and these links have been sent to you. We are really keen for you to listen to this presentation and to the others and to let us know what questions you still have. We would like to hear about your experiences and suggestions and for these to be shared across the sector in the South West. So please do email your questions and comments and dial into the upcoming teleconferences. So again, these are the key websites, and we recommend that if you haven't done so already, you pause now, search for these and save them to your favourites or bookmark them. So this slide set will focus on accepting new admissions into a care home, managing isolation precautions, including cleaning and management of laundry and waste, and how to recognise an outbreak and what to do. This slide summarises infection control precautions. So the standard infection control precautions are the measures that you need to take to prevent the spread of infections from person to person by protecting staff from blood and body fluids, but also to stop the transmission of microorganisms even when an infection is not present, for example, from the germs that we all have naturally on our skin or those found in the environment. Standard infection control precautions must be followed by all staff in all care settings and at all times for all people, whether infection is known to be present or not. You'll already be familiar with these measures and they're listed here on the left-hand side. So now is a good time to ensure that all of your existing policies, procedures and staff training is up to date with these practices, and links to documents to help you with this were attached to the email sent. Transmission-based precautions are the additional measures on top of standard infection control precautions that are needed for the care of people with known or suspected infections. And these depend on what we know about the way each infection is spread. So for COVID-19, we're talking about contact precautions and droplet precautions. So this presentation will now focus on isolation and safe management of infected waste and linen, as well as cleaning and decontamination. The other videos cover things like hand hygiene and personal protective equipment. As part of the national effort during this pandemic, the care sector plays a vital role in accepting admission from hospital. Residents may also be admitted to the care home from a home setting. There is NHS guidance for hospitals on discharge requirements, and the link has been sent. Communication and risk assessment with the hospital discharge team is vital, especially as you'll not be able to visit the person in hospital to do your usual assessments. So the information the discharging hospital will let you know about, amongst others, is the date and result of any COVID-19 tests, the date and onset of symptoms, and a care plan for discharge for isolation. Some of these patients may have had COVID-19, but all can be safely cared for in a care home, whether symptomatic or not. People diagnosed with COVID-19 in hospital do not require further swabbing, and so people with COVID-19 do not require a negative swab prior to discharge from hospital. The precautions that will be necessary in these situations will now be discussed in the next slides. This table is provided in the care home guidance that you signposted to earlier from the key websites. And it talks about the actions to take when you take a patient back from hospital. So if somebody's discharged from hospital and they have no symptoms of COVID-19, then you can provide care as normal. You obviously need to watch them for 14 days to check them for symptoms, as you will be doing for all the residents in the home. If a patient tested positive for COVID-19 in hospital, they no longer have symptoms and they've completed their isolation period, you can provide care to them as normal. If they tested positive for COVID-19 and no longer have symptoms, but they've not yet finished their isolation, then they will need to continue to be isolated for 14 days after the onset of symptoms or positive test. In addition, if a person has been exposed to COVID-19 while in hospital for another reason, so they might have been in a shared bay with a confirmed case, then they too should be isolated for 14 days following their last exposure and monitored for symptoms. Just to note that hospitals may isolate patients for 7 days, but in the care home setting, we would like you, and the guidance recommends that you isolate them from 14 days from their onset of symptoms. So we realise that trying to keep people in their rooms, particularly when they start to feel better, can be really challenging for care homes. There are some practical steps that could help. Try and ensure the best use of technology using smartphones and video calls, and tablets, that sort of thing, to connect with family and friends and to encourage people perhaps to stay in their rooms. You could close the doors of other residents' rooms if it's safe to do so. Give meals to and clean the rooms of well residents, particularly those who are shielding, before unwell residents. It's really important that you increase the frequency of environmental cleaning, particularly of touch surfaces, and this is especially important where you have residents who walk with purpose. Remember to follow your existing pathways and seek advice from your local authority deprivation of liberty leads, safeguarding leads, or adult safeguarding team. You could also look at this guidance, the ethical framework for adult social care in the response to COVID-19, and the link has been sent. We're really keen to hear what ways you are trying to tackle this and the measures you're taking to try and encourage people to stay in their rooms or to socially distance. And so let us know by email, and we could share that good practice during our teleconferences. So as we've just said, isolating individuals can be really challenging. And so the advice here is really about the ideal scenario when you're isolating somebody with suspected or confirmed COVID-19. Your ability to maintain isolation will differ from home to home and resident to resident, but I hope that this will give you some principles to work with. So residents with suspected or confirmed COVID-19 should stay in their own single room with ensuite or dedicated bathroom, including for meals. The door should be closed where possible and where it's safe to do so. If it's not possible, try and ensure that the bed is moved to the furthest safest point in the room to achieve a 2-metre distance from the open door, or at least a 2-metre distance. Close the door of any rooms opposite if this is safe and possible, and ensure that this is not the room of a person who is shielding, as they are extremely vulnerable to COVID-19. Increase the frequency of cleaning and disinfection of the affected room and in the area just outside. Declutter the room as far as possible, taking into account the needs of the individual, and the use of fans should be avoided. Place a sign on the door to prevent anyone entering unnecessarily, and also to remind them about the use of personal protective equipment, but you need to maintain confidentiality. And this rainbow sign is something that I've heard about, that a care home is used to indicate when a person is being isolated due to symptoms. You may have other methods, and again, we'd be keen to hear about these. If the affected person needs to be moved out of their room for an essential reason, then they could wear a surgical mask if it is tolerated. So decontamination of equipment and the resident's room, their bathroom, the care environment must be performed at least daily, but more often if possible. Use disposable cleaning cloths and mop heads, and try and clean the rooms of symptomatic residents last. To clean and disinfectant room, you can use a combined detergent disinfectant solution, which achieves a dilution of 1,000 parts per million of available chlorine. Or you could use a general purpose neutral detergent in warm water, and then follow this with a disinfectant solution of 1,000 parts per million of available chlorine. So the box here on the slide gives some practical tips for some products, others are available. So for example, to achieve the recommended concentration using Milton, you would add 50 ml of Milton to 950 ml of water. But it's important to add that you do need to check the labelling and the manufacturer's instructions, follow those, and the recommended contact times, the amount of time something needs to be disinfected for. Residents should have their own designated equipment which remains in the room. So if this is not possible, then equipment must be decontaminated after removal. So that includes cleaning and disinfecting as previously described. This table is available on the gov.uk website in the infection control guidance and has been circulated to you. So in terms of waste, the personal waste generated by a resident suspected or confirmed as having COVID-19 should be stored securely within disposable rubbish bags using the usual waste streams. And there at the bottom are the various waste streams. Black is the domestic waste, yellow black stripe or tiger stripe is for offensive waste, and the orange bags are for the use of disposal of infectious waste. These bags should be placed in another bag, tied securely and kept separately, and then be set aside for at least 72 hours before being disposed of as normal. All linen and laundry used in the direct care of people suspected or confirmed as having COVID-19 should be managed as infectious linen. Wear disposable gloves and an apron when you're handling. Do not rinse, shake or sort the linen on removal from the bed. Don't place it on the floor or on other surfaces. And once it's bagged, don't rehandle it. Place the laundry straight into a water-soluble, sometimes known as an alginate bag, inside the room and secure. And then once outside the room, place in a secondary bag and store it in a designated safe, lockable area as per your usual processes. So this poster has been emailed to you, and we recommend that this is displayed for example, in the staff office or staff areas. So if you notice 2 or more residents meeting the criteria for it being a possible case of COVID-19, then you might have an outbreak. And we talked about these symptoms a bit more in the first video. If you think you have an outbreak, call us in the health protection team to discuss it. So the number is provided here. We can help you to risk assess whether or not we think it's an outbreak, and then also advise you on the actions that you can take, taking into account your own kind of personal circumstances. So cohorting refers to a grouping of residents or staff together in one area or unit of or wing of the home according to infection status or risk. This may be required if you lack single room accommodation or if there's an outbreak in the home. Your ability to cohort depends on the type of accommodation you have, the characteristics of the residents, but you might want to think about how this could work for your home. And here are some principles to consider. Try and allocate staff to look after suspected cases or confirmed cases only, or for an outbreak floor or wing. Allocate staff to look after residents who are well, but who may have been in contact with COVID-19. And allocate separate staff to look after the vulnerable residents, particularly those who are shielding. Just to note that agency staff can work across different settings as long as they adhere to the precautions described, and ideally would look after non-symptomatic residents if possible. If you don't have single rooms and you've identified a number of residents who are contacts or suspected or confirmed cases, then you could care for those in a single unit. So the cases in one unit and the well in another. If you have an outbreak and perhaps a number of cases and they can't have their own rooms, then you can try and cohort them onto one floor or unit or wing. Ensure that the residents who are well but require shielding have their own room, and if that is not possible, they need to be in a separate area away from cases and contacts, and they mustn't share a bathroom or any other areas with any other residents. So the health protection team may advise swabbing for the residents in some circumstances. So when you call us, we can talk to you about that. So at the moment, swabs will be couriered to you and instructions are provided. It's really important that you carefully read these instructions to make sure that the swabs are taken safely and are labelled properly. Otherwise, the lab may reject and not process the specimens. Remember that PPE needs to be used, and that includes eye protection when you're taking swabs from the nose or throat. So this is just a quick slide about the care home capacity tracker. So I think you've all been asked, so all care homes and hospices have been asked to input information on the capacity tracker. There's a lot more information in this document that you were signed and posted to earlier. And so have a read of that if you haven't already registered. But just to note that if you experience an imminent risk to continuity to care, such as potential closure due to the number of cases or a lack of staff, please let your local authority know without delay. So again, here are the web links that have been sent round to you. These keep changing, so it's really important that you keep an eye on these. And thanks again to colleagues in the Public Health England health protection teams in the South West and in London, and to colleagues in NHS England, NHS Improvement. And also to remind you to please send in your feedback, questions and suggestions and join our teleconferences. Thank you very much.